Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
I think you're driving him crazy. Hello, you're driving everyone crazy. I am being driven crazy because Dr. Mencia.
The espresso.
Because, when Dr. Mencia comes in, this whole room gets on fire. It is
This house is on fire.
and we have Ina
one call away.
Just one.
AGI will be just one call away. Or a text. We can be a text away.
Text away.
A text away. That's good.
Yeah.
That's a new song.
The song, one call away. I'm better than Superman. I'll be
No Superman. It's Wonder Woman. It's Wonder Woman.
It's a Wonder
not
Woman.
Superman anymore. It's Wonder Woman.
If you're short of breath, I'll be one call away.
That's
if you're
very
having
nice.
diarrhea, I'll be one call away. If you are constipated, I'll be one
we know
call.
about constipation. Well, but I have to ask you a question. We never talk about, not very often, about your dental department. How is it going?
You know something? I am so proud of the home visit department and the dental department because they have shined so high this week. I am so proud, so happy with both departments. Let me give you a story. Jason, who is one of the nurse practitioners, went to do, and he's so devoted to home visit. It's like we could not have gotten a much better person to do home visit. He's so devoted.
He's a nurse practitioner?
His heart is so into this, and he loves what he does. It's like me when I go to work. I love going to work. I love what I do, working with my geriatric patient and what have you. And he saw this lady who is in pain, and the daughter said, my mother is in pain. And she struck out. She's nonverbal, and she cannot communicate that she is in pain. And Jason saw her, and he so thorough. He looked at to do a full physical and said, I had to get the dental in here. I think it's from her teeth. They look really bad. So he spoke with us, called the dental department. We arranged for one of the dentists to do a home visit. One of the dentists went there and he said, definitely all of those teeth need to come out. It's about 7 or 9 teeth altogether.
Wow.
But they all need to come out. And the daughter said, you know something? The last dentist that we took her to, because nobody would come to us, of course, they look at her in the hallway. And in the hallway, they told us, without putting her in a room or taking an x-ray, in the hallway, they told us that she need to have the teeth taken out. We need to have an oral surgeon. That's another specialist. And most likely, it will have to be done in the hospital. And it will be very, very costly. So the daughter doesn't have that kind of money. So she was telling the story to the dentist and said, well, let me talk with Dr. Mencia. I'm sure we can do something, to lower the cost and do it at the office. As long as you understand it's a risk we're taking with your mom. But if she's going to go, let's go fighting. Let's fight this case. Let's try to get your mother better. So the daughter agreed. She comes, sign consent to take the risk with us. Everything is set. The anesthesiologist come in, set up his stuff. When he looks at the patient, Anita, he walk out of there like a bat out of hell. He comes running looking for me. Yeah. He said, Dr. Mencia, I never done this as an outpatient. I go and I look at the patient. The dentist is scared. The anesthesiologist is scared. So I say, guys, let me tell you something. This can be done. I'm going to show you how we're going to do this as a geriatrician. I'm going to give you my input. We are not going to put her to sleep and then give her oral sedation, local sedation in the teeth like we normally do. We do block despite the fact that the person is being put to sleep. I say, I want you guys to go first, dental department, go in, do all the blocking you need to do first. Then the anesthesiologist, I say, all I want you to do is use 1/4 or less of the Versed that you would use in a patient, her age. Because she's already stroke out, she's not verbal. I say, I don't think she needs that much, to get her comfortable for us to do the procedure. So the anesthesiologist said, well, I've never done it like that, but we can try it. I said, good, let's try. Then I told the dental department, now, first you go in, do the block, stay in the room. Dentist and all my assistants stay in that room. I don't want no one person to move. Ted is going to push the Versed a tiny little bit just to make her comfortable. Dental, this is going to be the fastest extraction of your life. You're going to go in there. I don't want any talking. I don't want any relaxation. Is you guys going to work like you never worked before. But we're going to keep this woman alive and make her comfortable. We're going to do those extractions. So I praised myself. We went, took her vital sign, connected to the machine so we can monitor her oxygen, her saturation, her heart rate. All the monitors were hooked up to this lady. The daughter was sitting outside in the waiting room with the aide. She was brought in by ambulance in a stretcher.
Wow.
So we used the largest room that we have for surgery, and we put her in there. And the dental department, they were sweating bullets. They were working so hard, these poor people. But we ended up taking all the teeth out, suturing this lady, leaving the IV line going so we give her some hydration. Now, mind you, she has a feeding tube. So we were able
complication.
But yeah.
Gosh.
She has a feeding tube. She has a Foley catheter. This is a case that most people will look. They don't even want you in a dental office. They do not want to see a case like that in a dental office. And, my pride is, thank God that I had been able to accomplish what we have been able to accomplish at AGI. Because when you look at home visit, Anita, you are not going to get neurologists or dermatologists or, podiatrists, people that want all the specialties that are out there. They won't come to the house. It's not cost effective. There are not too many primary care or internists that want to do this. It doesn't sound cost effective. But the volume of patients that are out there, with a good primary care team that is able to take the initiative, because, you don't have to be a nephrologist to work up the kidney. You don't have to be the cardiologist to work up the heart. But you can do all the preliminary work so that you can send the patient then to the nephrologist, or you can consult the nephrologist. And God willing, with the telemedicine, we might be able in the future to bring more specialists to the homebound patient, because it breaks my heart, Anita. It just breaks my heart when I see these people that the providers out there that are going to a lot of them just going to take advantage of their insurance, not because they're really going to care for that patient. So they go in and say, well, I think you need a wheelchair, you need a hospital bed, you need a walker. The person cannot even walk. Why are you going to get her a walker? The patient is homebound, chairbound. We don't need a walker. Bedside commode, maybe. What does the person really need? Let's be honest and be humble when we care for these people. And then,
Wait, let's finish telling the story with the woman. So what happened?
So we managed to suture everything, and I monitored her until she finally was more alert. Then between John from the medical department, myself, and the two ENT that came, we were able to transfer her back on the stretcher. And she went on her way, and she's doing fine. Jason is going to follow. By the way, she's on blood thinner. She's on Coumadin.
This is absolutely
She's on Coumadin, so we have to stop the Coumadin. When she came to the office, we monitored the INR that gave me the level of Coumadin before surgery. And then we had to now restart her Coumadin, and Jason is going to follow up on that, make sure she restart and monitor the INR.
This absolutely makes me love you more than ever because, I think I was one of the people before you started this that told you about my mother here. The doctor expects you to bring someone that can't even get out of bed, and they won't come, and it was a horrible thing. I literally paid him. I said, you have to come on a Saturday because I don't know what I'm doing. And so consequently, I felt there was a need, but that no one goes to the homes, Dr. Mencia, and that's when you decided it's a very big commitment for you to do this, and you had to have people willing to go. A lot of things had to happen, but you did it. I am so proud of you. Your points are so high, and because
medicine is biopsychosocial. Biologically, what is giving me the headache? Psychologically, what is the headache doing to me at work? But economically, socially, am I able to afford treatment for this headache? So it's biopsychosocial. Any and everything. When I have the med student with me, when we have the resident rotating with us and the student from Nova, we try to educate them on the fact that each and every aspect of medicine is biopsychosocial. It's not one medicine I can give you, it's what medicine I can give you that you can afford. Otherwise, it's a prescription that I can throw out the window because you're never going to get it. So when it comes to home visits, there is the social component, the economical component. It's so hard. It's so big. We call Alzheimer the empowerment of the significant other. Because when you have a mother or a husband or a wife or a kid that is homebound, you have to get aid to come to the house. That costs money. If the insurance does not cover that, if you don't have long-term care insurance. Socially, the mainstream society, they might be comfortable with saying, okay, so you cannot go to see the cardiologist or the neurologist or the nephrologist anymore. And the specialist might say, just go to a nursing home then. If you cannot come and see me anymore, just go to a nursing home.
Right. And
they don't think that home visit is a way of keeping you in the community. Mm-hmm. That's for the mainstream. But then comes people of other ethnicity that do not believe in nursing home.
Wait, I'm glad you brought that up because Ina's sitting here. I want to ask Ina something. In Russia, before you left, were people now taken care of in their homes more than they do here, Ina?
Yes. We don't have too many nursing homes back home. Like Russian people, like Hispanic people, they're family oriented. So if something happens to my mother or father or any member of my family, I'm not going to send them away.
But I'm going to keep them with me. But were you able to get medical care at home like Dr. Mencia is doing here?
When I left my country at that time, we didn't have anything like home visits. I don't know what it's like now.
No, but so what happens to people there who need a doctor? They're home and they can't go out.
Yeah, I know in Europe is home visit is more popular than here. They are well paid. They are very well covered. And when I go to Germany and I see patients in Germany, private patients that I follow up in Germany, it is easier for them to get anything to come to the home. Anybody, any specialty to come to the home. So the people in nursing that are homebound in Germany, not only the people that are homebound, listen to this. I have one case where the mother is in her 80s and the daughter is in her 60s. So she's still able to walk and drive and everything. But because the mother is homebound, the government will provide her care at home. So she doesn't have to leave the house. Mm-hmm. So they give her that option, that if you need something, we'll come to the home for you.
Well, did it stop when we had doctors who went and they didn't have offices. They went and visited patients.
Right.
That's what started years
Right.
ago, right? I mean, many 100 years ago.
That
And
we
then-
used to have the little bag,
Exactly.
the little black bag.
Yeah, exactly.
Brown, the little
Yeah.
brown
bag.
of, yeah.
So what happened? How did that all evolve into come to my office instead?
Then capitalism took over. And if I'm in an office where all the patients come to me, I'm going to make more money. I'm going to see more patients.
That's how it happened.
Then HMO came over, then capitation came over. So then the economy took over the care. And, that's what driving the country.
And when you
know?
think of it, when you went to someone's home, you got to see their environment, their family. You got to know them better. It's such a difference. Now they come into the sterile. They're scared anyway. They're coming into an office, right? They're cold. It's.
Well, imagine you go into a house that there are 3 steps to go from the living room to the dining room, 4 steps to go into the bedroom, 3 steps to get out of the house, and the person has a hip replacement. And then you're going to say, okay, he's a walker. A walker for what? My house is not fixed for me to be walking around with a walker after a hip replacement. So the visiting the home and looking at that component of healthcare, it becomes extremely important. Those are the patients that will come back to the hospital after surgery or after being discharged. It's what we call those revolving door. They go home and then they come back and say, well, send him to a nursing home or her to a nursing home.
Right.
Because she just keep coming back to the hospital.
That's why we send the nurses to establish the care after the patient being discharged from the hospital within 7 days. So that way the doctor, the nurse, they will establish what they evaluate patient, what patient will need after they discharge. Because a lot of times what happens when they discharge the patient, they don't provide anything to a patient. No hospital bed, no DME, any equipment. So it falls on us, on my nurse, on my doctor, to follow, to order, and the staff from the office will do all of that.
Or to discontinue things the patient might not even need, so we don't waste Medicare money,
Well,
I'll tell you a story.
Okay, wait, before you do that, this is
gonna give you
Dr.
the phone
Andy
number.
Mencia.
954-489-1345.
in
Fort
Fort
Lauderdale.
Lauderdale, and we are open on Saturday.
Yes, today.
I'm going to do that again. Get your pencils out. Get your pencils out, everybody. Make this call. 954-489-1345. They are located on Commercial Boulevard, very close to Holy Cross. And I have to tell you that once you go there, you will enjoy.
I got to say something.
What?
Boynton office, we're going to be, myself, and I.
Yeah.
I'm going to be going to the Boynton office twice a month.
Starting September.
Twice a month on
Twice
a particular
month.
day.
Instead of once a month.
So instead of once a month, so those patients, they say, Dr. Mencia, you only come here once a month.
Twice a month.
So now I'm going to
2
be
times a
coming
month.
every other week.
Every other week on a particular day or no?
Wednesdays
afternoon.
Every other week.
Wednesday.
One call away.
I'll be one call
away.
or a text.
Oh, that is so. You owe text. That's very good.
So the Boynton office will be open.
Super.
Yeah,
That's
yeah.
great. Okay, well, let's just keep going with this. So
Yes,
now-
let me tell you.
Yeah.
A nursing home, I remember 15 years ago.
50 years ago?
15.
Oh, 15.
One
That's
five.
fine.
One five.
You scared me.
Come on, let's
He
get
was
it
in a-
together here.
he
Bring
was in
her
a
some more
bas-
coffee, Richard.
He was in a
Another
bassinet.
espresso. 15 years
got
ago,
diapers.
they asked me to do a consultation on this baby boomer that was going to be put into hospice. And I go in the room and I see this guy in his late 40, early 50, basically with the muscle all wasted and no appetite. He wasn't eating. I said, but why is he wasting? He said, oh, we don't know. So we just say multiple medical issues because he went to the hospital and has had a pneumonia. I said, that's strange. He's young. So I said, let me do some blood tests before we do hospice. He said, no, it's for hospice consult. I said, I don't care. I don't want to make a mistake. Let me just make sure. So I do all my blood tests, and the guy is HIV positive. on no treatment for HIV.
Oh.
So I said, wait a second. So no, this is a nursing home. This is another thing. You are not going to get ID doctor to come in and see patients. You better be a good internist if you're going to do nursing home or home visit. You better know your stuff because you don't have people to come and tell you what to do. You have to try to do it yourself. So I bombarded this guy with medication, started treating the patient, give him appetite stimulant. Hospice people angry at me, like, what are you doing? We're losing the case. I say, you're not losing no case,
Boy.
I say, as a geriatrician, I've been trained on comfort care. So if it comes to comfort care, I'll do that. I'm not trying to be a hero. I just want to make sure that we're doing the right thing. Just give me a chance. Anita, in less than a month, the guy was sitting up in bed. And I called the hospice nurse. I said, this is what you want to put in hospice. Do you still want to put him in hospice? She goes, no, doctor. I say, it looks like he's responding. I said, of course. He's only have HIV. He was not being treated. He was being neglected for HIV. We can be sued by that for the family. So let's treat the patient. The patient still come to me today as an outpatient. He lives,
that's the most wonderful story.
He lives at home. And he still come to us as a patient.
I'm glad you brought that up because I just, I don't know if they told you this, but the lady that comes, she's in her 80s and she comes from the Florida State Department of Health in Broward County, she brings condoms. She gave out 7,000 condoms at the...
Where's my condom? No,
I have them.
Yeah?
Let me tell you, I have a bag of them. You know what?
In my box of
I'm gonna bring
magazine, I thought it would be... No,
I'm going to bring condoms for your staff.
No,
we
have in this. We have
but
at
wait,
the
these
office.
are all... But wait a minute. They're not just plain. They're
Colorful.
They're colorful with food. They're fruit flavored and different things.
I don't know about the flavor.
Oh, I have them. I mean, anyway, can you imagine?
Okay, let's go back to let's go back to home base.
It's getting hot in here.
Yeah, that's right. We have to.
Can I have the sherry, please?
But the point is, I wanted to talk about that. So she was on the radio show, and she was telling me that there's a pill to take. That men can take this pill to not get.
It's called the PrEP.
Yeah, she told me about this pill. We never talk about that.
Yes,
why is that not spoken about?
We are talking with the health department. There's a website that has been created. We are on the website, and we are one of the centers that will provide the PrEP for the patient. So if patient go into HIVprep.com and they look for providers in Broward County, our center is one of those centers that will prescribe the PrEP for patient. And, I've seen a few cases of couples one with HIV, and the other couple will go to one of those events where they do free testing, and the other person will become positive, and they didn't know about the PrEP treatment. So there's awareness being brought on.
That's why this
PrEP.
woman comes to the show. I mean, she talks about this, and I couldn't believe she gave out so many comments. But that's smart that people are being very careful.
The
about
center,
it.
we do basically everything that is related to internal medicine and everything. We do weight loss. We don't charge for weight loss. I think it's a social issue. Before one of my patients end up with a heart attack, I want to prevent one. How many we have prevented, who knows and who cares? But we have 2 dietitians that work with the patient.
And we had our wonderful dietitian on last week.
Right. We have 2 dietitians working. They come on Saturday. We have a neurologist. We have a dermatologist. We have ophthalmologist. We have Dr. Ramahan.
Endocrinologist.
Who is an endocrinologist. He's excellent. My patient just love the heck out of him, He's so humble, such a nice guy. So, the group is growing
you really have it all.
in different providers. And the patient love that because they come to the center and it's like a menu in a restaurant. You pick and choose. I need to see the dentist for my cleaning and the podiatrist for my calluses.
But excuse me, but they come into you first, but you're the one that starts all this off, don't you?
No, it depends. It depends. There are patients that come only for the dietitian. There are patients that come only to see Dr. Ramahan for diabetes. And then when they are there, they say, you know what? I want to see the podiatrist here. Mm-hmm. Or I want to see Dr. Mencia I want him to be my primary. So it's up to the patient. They choose from the menu. You can go to the restaurant and say, I don't want any appetizer and no dessert. Just give me my main course.
Right? I don't want to share it. I want a pineapple today.
Thank you, Dr. Mencia. Yeah. This was wonderful. We'll see you back next week, everyone.
I'm not leaving,
No, the phone number again. He's open Saturdays. Go down there just to say hello. 954-489-1345.
I'm going to the spa.
Oh, yeah, always going to the spa? Yeah, all right, but not, but you know what? You can always find Boomer Times there, too. A lot of people ask me, where can I get Boomer Times?
He flies.
Yeah, well, just go down there, and they have them. We'll be right back.
I'm only one call away. I'll be there to save the day. Superman got nothing on me. I'm only one call away.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.